from breakthrough strategies to game-changing innovations and cultural shifts. You'll discover the lessons that drive real impact, and we'll dive into the moments that changed everything. Welcome to The Missing Piece with April Reed. Today's guest is Nick Yaitsky, a transformational healthcare technology leader and one of the leading voices in how artificial intelligence is being thoughtfully applied across healthcare. Nick is Chief AI Officer, Enterprise Architect, and Strategist who operates at the intersection of innovation, governance, and real-world execution. What sets Nick apart is the ability to move AI from theory into practice. He helps organizations design the frameworks, policies, and platforms that ensure emerging technologies enhance patient care, support clinicians, and drive operational excellence without losing sight of trust, safety, or human experience. With deep expertise spanning AI strategy, digital health platforms, enterprise architecture, and large-scale digital transformation, Nick has spent his career modernizing complex healthcare environments from the inside out. Today, we're unpacking what it really takes to turn AI ambition into measurable impact and exploring the missing piece that separates hype from lasting transformation. Nick, welcome to the Missing Piece podcast. Happy to have you.
Thank you so much, April. I'm thrilled to be here.
Excited to continue the conversation. We've talked a little bit, but I want you to tell me, who is Nick? Who is Nick Yaitsky? How did you become the genius that you are? How did you get in this world? How did you get into healthcare? Tell me all about it. Tell me who you are.
That's a great question. So first and foremost, I am an engineer by training. I am not a doctor. I'm not a nurse. Do not ask me healthcare clinical questions because you will not like those answers. I guarantee it. But I feel like I've been around the healthcare sector for a long time. I come from a family of physicians. And I just ended up going into the engineering side of the house more so. Georgia Tech, bachelor's, master's, really focused on really driving technology from a human perspective. Somehow or other, I landed in the healthcare sector, and I've been in the healthcare sector for well over 15 years now, building health and wellness solutions, driving that patient experience, driving that adoption for new and innovative concepts, new and innovative ideas for how can we make a better healthcare experience. I spent a long time in the startup realm, worked with a number of them early on, later on, to really drive that evolution, that transformation. Most recently, I was in a purely clinical organization and really driving a lot of the adoption within that setting as well. Since then, I'm currently the Chief AI Officer for Lulov Technology Partners, where we're an advisory firm where we're helping startups and mature organizations on how to really be more AI native. How can we use AI to create a more human healthcare experience? That's really the focal point that we're shooting for.
I love that. I mean, there's so much. I mean, you just told me a lot in like a few sentences. Curious, going back to Georgia Tech and the beginning and you kind of stumbling in the healthcare space, I want you to just shed light on a little bit more of your journey, not only in the healthcare, but then the computer science world and implementing AI to the things that you've said to like where you are today. If you'll just kind of go a little bit more deep, it's like, okay, over 15 years spanning multiple organizations and making transformation. But tell the audience just a little bit more about kind of like your journey, because I'm sure to the students at Georgia Tech, that are going to listen to this or anybody else, they're like, okay, well, how? You know what I mean? And then if I'm studying, what is something that I need to know? So just give me a little bit more about that.
Absolutely. I've been in this space for well over 20 years, 15 of which have been in the healthcare sector specifically. But the thing I would say is this. What you learn in school is really what sets your foundation, but it does not actually teach you the specifics of what you're going to be doing. Because fundamentally, technology evolves. Technology grows, technology changes. It's never constant. Fundamentally, it's never constant by design. And, I've been doing AI concepts and AI work for the better part of these 2 decades, long before AI was the buzzword that everyone spoke, everyone talked about, right? I spent a long time building these digital therapeutic concepts, ways of taking real-time and near real-time data that is flowing continuously about a patient, information from their wearables, their clinical information, background information, you name it, their activities, using that in a way that is able to create a not quite a recommendation engine, but a guidance tool, a mechanism to identify the next best action, the next thing that should happen. Now, this is not Gen AI things that were done before Gen AI was the popular thing to do. And so we spent a long time building these kinds of concepts that use traditional AI, traditional machine learning, allow these concepts to really drive that next action. As
Mm,
Gen AI became more popular and really opened up ever since ChatGPT went live, right? That's now a household name. And people open their eyes to see what can it be? What can you actually do with LLMs? What are the possibilities? That's
mm,
now evolved into what we call agentic. But
mm.
the truth here is agentic as a concept has been around for a long time, many decades, long before I got into technology. Agentic has actually been around. We just haven't talked about it in the settings we talk about it today. These days, what sets it apart is that we now combine the agentic concepts of technology, which is really a machine performing actions based
Mhm.
on certain stimuli, based on certain input.
Yeah.
But we've combined it with human language, with large language models, with the bots, the agents, the foundational models that are now out there that can do so much more. We don't have to write code directly to build these agentic systems anymore. Whereas in
Mhm.
the past, that was the case. You had to be a software engineer to really be viable at building these things, right? Now you don't have to be. Anyone can build these things. These things are far more democratized as a result. But your question about what should students study or not study, computer science is still a space that I highly recommend people studying. But I feel like at this point, we need to do more than just computer science. We need to go beyond that and think through the way that computer science is applied fundamentally to the human experience. How do
Yeah.
we bridge that gap, whether it's HCI for human computer interaction or robotics or you name it, right, in that space? And so we
Mm.
go well beyond just the fundamentals of computer science to really build a lot of these concepts, a lot of these more modern systems.
I love that. And similar to you, I've been in this space for a little over 20 years in healthcare specifically. And so I'm super passionate about healthcare and the technology. To me, it's exciting, where we're going and where we're heading, and to really, drive population health, to improve the care for patients and the tools that you just talked about that have been doing it for a while and are only going to continue to improve. I'm curious your thoughts. I call this podcast the Missing Piece podcast because I like to identify missing pieces in digital evolution within healthcare specifically. Because you and I are both in that space. But what do you think are some of those missing pieces in healthcare's digital evolution that maybe aren't being addressed yet or that you've seen along the way?
Yeah, you say exciting, and it's a little terrifying at the same time, isn't it?
That's true.
It's kind of blending both of those avenues. It's exciting and terrifying. And I think what's terrifying most people is just the lack of understanding of what it can or cannot do, what it really is or is not. There's that mindset of, well, the machines are going to take over the world, right? Every single sci-fi movie that exists talks about this. And it's not about that. It's not about sentient machines. It's not about that element of it. It's about using these tools to make our day to day easier and more productive and more knowledge based. So, using foundational knowledge, the things that we know to be true, to create things that give us the tools we need to be that much better at our day to day jobs.
Yeah.
So, just fundamentally, when the internet revolution started occurring and email became prevalent for everyone, that fundamentally changed the way we operate, right? The speed at communication increased so drastically over time that it just became that is the de facto standard. With AI, it's a similar thing. The type of information we're getting and the way we're getting that information is changing and it's becoming that much faster. Instead of searching on a web browser for however many minutes or hours or days you're going to do research, you're now asking questions more pointedly, more directly, and getting responses more directly.
Yeah.
That cuts down your time drastically.
Yeah.
But to really answer your question around that missing piece, when I think about the healthcare experience that we have today, the thing that I feel is missing the most is the collaborative nature of solving clinical problems. We in the The healthcare sector, the physicians, the nurses, the advanced practitioners, we have some amazing people working in this space, some brilliant individuals working in this space. The problem I keep seeing is that many of them are working in a silo. Many of them are working by
Yeah.
themselves. I have my clinic, I see my patients, specialize on one specialty. That is what I do, pure and simple. But so many of us patients have more than one doctor, have more than one provider for different things. And the reality of healthcare is that all the healthcare conditions that you're dealing with, they all overlap, they all intersect. And so the thing that I keep seeing as a missing component is that, of course, digital experience, but at least the human experience of combining and collaborating on these problems. So if you're going to your primary care doc and they prescribe you something, and then your pulmonologist looks at something and they prescribe you something, and then your cardiologist looks at something and they prescribe you something, and then you go to an urgent care and they're looking at something specific and they give you something, who's checking up between all those folks? Who's talking to everyone to figure out what is the right method and a protocol for this specific patient? It really doesn't happen that much. Sometimes, but rarely, I think. If you're in the hospital setting, yeah, the specialists are all talking to each other. There's a lot of kind of collaboration there. When you're outpatient, which is most of us, they're not talking to each other. So how can these digital tools, and especially AI tools, start to create this experience where your healthcare is more holistic in nature? It's bringing everything together into a singular environment that the experts in the space, the physicians, the nurses, and everyone are able to discuss and deliberate and figure out the right solution for you.
Okay, so you're blowing my mind a little bit because I didn't know that there's tools out there that are starting to do this. Because I mean, like, I'm just sitting here going, exactly. Yes. I mean, interoperability as a whole has always been a thing, from inpatient to then outpatient to then, all the things,
Hmm.
and they have different, applications or different EHRs and they can't talk
Hmm.
and you don't know. But I love what you were saying. How do you treat the patient as a whole and not, okay, now to your point, now they're at pulmonology, now that they're ENT, now they're over here in neurology, then they're
Hmm.
back to their internal medicine doctor. I love that. Wow, that's powerful.
Yeah.
That will be very powerful to have tools like that to collaborate with. That's amazing.
And just along those lines, you mentioned interoperability. The thing is, we always talk about interoperability. Every single healthcare system, every single EMR, we always talk about interoperability. But really, what we're talking about there is the pipeline to share data, to send data from one place to another place. That's only the tip of the iceberg. That's only kind of a foundational piece, really, of what we need there, right? Simply interoperability for moving data from place to place only gets us the baseline of data being available, but not the insights on it, not action on it, not deliberation or discussion about it, just simply data being available.
Yeah, absolutely. That's amazing. I mean, AI, to your point, it's been around for a long time
Hmm.
and it's been a discussion for a long time. Having ChatGPT be a household Google, if you will, now, and everybody thinks, it's going to take over the world. How do healthcare's organizations even truly get started? The ones that they maybe have some tools that they're using or they've implemented, they don't have a chief AI officer like yourself, or they haven't hired one yet. What is your advice to the C-suite that are listening on how to get started? Where do they even start? What is your advice there? What do you do from an advisory service perspective? Tell me more about
Yeah,
that.
absolutely. So fundamentally, it's not about finding the right tools. It's not about that. It's about getting alignment and partnership within the organization. It's
Mm.
about getting a willingness to evolve in the day to day processes. It's a willingness to relinquish control of some of these processes. And this is something that I feel strongly that the healthcare ecosystem struggles a bit with, and for good reason. Our physicians, our healthcare practices are very protective of their patients, as they should be, right? The physicians want to make sure that their patients are getting their best care possible, and they're protective of that population. There are some processes, though, that when you're applying AI to them, you have to realize that those processes will not be 100% accurate every single time, because AI in its modern definition is not 100%, by design, but also by implementing some of these things, you need to be willing to relinquish some amount of control over the actions or the deliberation process when you're dealing with your patients or your back-end processes. And that's hard. That's hard for a lot of people and a lot of organizations because we want to own everything, want to hold everything. If I can't see it, if I can't touch it, it doesn't exist. Well, it does exist, and it's okay to relinquish some of it with the right guardrails, with the right checks, with the right boundaries. And as long as you establish that process around the process, then you're able to automate the internals that much more effectively. The specific tools, the specific models, the specific engines for agentic or non-agentic, that will all shake out. There's so many of them out there that that's not the important part. It's organizationally. If you are organizing the technology team within the organization and you're trying to figure out, I need to have this group doing AI, this group doing data, this group doing something else, that's not enough. You have to go entire organization wide. You have to have the operators involved from day zero. From the very beginning, everyone has to be both hands in saying, yes, we are willing to adjust our day-to-day processes. We're willing to potentially reshuffle our own departments and perhaps even reduce some of our budgets that we have in order to fund some of these things. We have to be willing to do that. If you're not willing to do it, then you're not ready for that yet. And that's okay. I'm not saying that every single team and every single organization has to be 100% AI. That's not the case. The fundamental concept here is you have to, from the top to the very bottom, everyone has to be in on it saying, hey, we want to evolve as an organization. And when I say everyone, I realize not every person within a company will be gung-ho about it. And that's fine. And so what I always like to do in that context is find your champions, find your leaders, find those that can be the advocates within the organization, the ones who can rally their localized troops to come to the table with those ideas. You're never going to have a central singular chief AI officer that explains to everyone in the organization, the thousands of employees, that here's what we need to do here, 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 and here. That has to be more on the ground within the respective teams. And so you find your champions, you find the people within the respective business units outside of IT that are able to really drive that point home, discuss it with their teams, bring ideas back to the group, and create that bi-directional discussion.
I love it. I love it. And I completely agree. Even how you just started there was, it's just not about the tool. It is 100% about the team and the organization and where do they want to go and the total buy-in. It doesn't matter how good your tool is. If you're not buying in and your leadership's not on board, it doesn't matter. But if you can think and see where you'll be in 3 months from now or 6 months from now, by leveraging or rethinking and implementing tools that can then be powerful and effective, all of a sudden, the operations, the efficiencies, the data, the reporting, it's there. So like what you're saying is basically get vision for where we're going and how we're going to get there, but making sure that everybody has that buy-in with implementing new technology.
Absolutely. And I think it even goes beyond just buy-in, right? It's a willingness and the drive to change, to be different, to realize that I know I've been doing this process for the past decade and I know this process end to end and I feel like it's a good process and it's a solid process, but can it be better? Does it even need to be a human process at all? Can you simply eliminate that as a human process, make that into a machine process or an AI process, and then go do something else that is more valuable for a human to do?
So you've worked in healthcare organizations for a long time, huge ones. And so you see traditional workflows and you see the digital ecosystems. So I'm curious, if giving advice, where do you see the most immediate and practical wins for AI inside operations, workflows, patient engagement? You can speak to all of them. You can speak to none of them, but I'm just curious, like where are the easy wins? So it doesn't, to me, it's, to you and I, we're like, no, it's not daunting. But to people that, used to use paper and now they have to use this EHR, it's daunting. So people that, understand the power of artificial intelligence, it's not scary. But then to those that are saying, what do you mean I just set up? Like my agent goes and does that? I don't understand, or whatever. But where are you seeing the wins? Where are you seeing wins specifically in healthcare organizations that are easy wins to tell leadership.
Yeah, I love how you use that analogy of the paper moving to the EMR. The reality here is what we've done with that paper for in many situations is we literally just simply made a digital piece of paper, but it's still a piece of paper that doesn't have meaning. And what I
Right.
mean by that is, um, I've worked in a project in the past where we were looking at radiology referrals. So you have different organizations, different clinics that are sending referrals to a larger organization or a hospital to say, hey, I need an imaging study done for my patient. I need them to get a CT scan or an MRI or an X-ray, something of the sort. Seems simple. Sounds simple, right? Pretty straightforward. The reality is that this is where interoperability comes in, is we are interoperable to receive digital faxes in these situations. Faxes are by definition just a piece of paper with information on it, but that information is just simply an image, so to say. It doesn't have meaning. It doesn't have any actual actionable data on it until you transcribe that into your EMR, into the individual fields that are semantic fields that say, here is the procedure code, here is the referring physician, here's the patient identifier. So we've taken a paper process and made it a digital paper process. And so low-hanging fruit for just about every single healthcare system these days is, where are those digital paper processes? And can we automate those? It's really the automations that are behind the scenes that are lowest hanging fruit, the easiest to really start to execute right away. You find the referrals, you find prior authorization processes, the workflows where you have non-decision making processes that are very manual in nature, that require a lot of human eyes to look and review and think through, but no clinical action is taken. And so a lot of these background processes, they cost a lot of time and effort, a lot of time and effort. Can we use that staff to do something more meaningful, something higher level thinking instead? So starting to automate those back-end processes is absolutely the low-hanging fruit in this space. And then you start to move into more critical things, pattern recognition within imaging, for example. I love the example of radiology using AI. The way I look at it is the role of radiology is changing rapidly, very rapidly. Instead of just having a radiologist looking at a single X-ray and providing the write-up for that, can we pre-process that with AI first? Can we have AI review it, provide the write-up, and have the radiologist review it? So the radiologist is not doing from zero to the end of it. They're looking at a generated result set from potentially multiple models that are looking at these things, and then reviewing and saying, yes, I agree with the clinical findings on this. How much more volume can we produce through this? How much more detail can we get through this? How much more can we find through these means? Especially when these AI models can also look at not just one image, but look at a history of images. And so this is not conceptual anymore. This is already happening today. There are several vendors that I've worked with in the past that are actively pursuing these models, that are building these models, integrating these models, and creating these automation flows where thousands, if not hundreds of thousands of images are flowing daily into these models, getting processed, reports are written up, and then the specialists that have the background knowledge review it for accuracy to make sure, yeah, I agree with this finding. But that way, they're not having to look for every single shadow and every single marker on the actual images. They're not having to mark up everything by hand. They can automate these things. And that's one of the things that I love about this is the throughput that we're able to create as a result, and the accuracy that we can create as a result is becoming so much higher, so significantly higher, that I love it.
Yeah, that's awesome. I could talk about this all day long. It gets me it gets me so excited. To your point, how many more things that we can automate to then improve patient care, to get back to seeing the patients, to get resources not doing these manual tasks, that take away from, what is possible. It's
Right.
amazing. So I know that you sit on the board with him and Tag Digital Health, which is amazing. So you're also not only, like I say, a little AI genius, and a healthcare know-all, but really being able to have your pulse on what is happening nationally on trends. I imagine you probably hear a lot of the things very quickly and early on from a trend perspective. You've been highlighting a lot of emerging technologies and tools that are coming. Where does Nick see healthcare in 3 years, 5 years? Looking at it holistically, like as nationally where we're going, what do you think? Where do you think we'll be, even if it's just one?
That's a great question. I'm thinking of two specific things that I'll bring up to you. The first one is this: the rise of transparent AI technology. What I mean by that is, for a long time, we've had wearables like, Fitbits, Garmin's, all these different things, right? Your fitness trackers. Everyone knows and loves and hates them at the same time, but they are devices that you can wear that can track your information, your watch that can detect your heart rate and everything of sorts. This is what I refer to as more or less transparent technology. It is there, you're not actively interacting with it. So we have been so used to that physician experience, that patient experience, where you walk into a clinic, you sit down, your provider comes in, they look at you for 3 seconds, then they turn to the computer and start typing away. Right. And then it's constantly look at the computer, look at the patient, look at the computer, look at the patient. That's not an effective experience. It's not personal, it's not human nature. And so the things that we keep seeing actively improving and actively getting so much better is ambient technology, where the physician comes in, pushes a button on their phone, it's now recording the conversation, much like our conversation here, detecting the voices, detecting what's going on, understanding the physician asked for this order to be placed and this study to be done, and this right here was discussed. It's collecting that information transparently. You're not having to actively interact with that device during the conversation. It's creating that human experience. So you combine that ambient technology with wearable technology for your daily sensors, combine that with camera technology. Cameras these days have become so much better, so much smarter. What I mean by that is on the edge AI computing on the camera itself, cameras that can detect the patient's movement when they're in the hospital setting and they're struggling in the bed. It's detecting the patient movement and providing guidance based on that. Cameras can now look at a human face and identify their heart rate. Can you imagine that? Detecting heart rate through a camera, as opposed to having to have an actual physical device, but things that you don't have to actively touch and interact with. That rise of technology is something that I'm extremely excited about fundamentally, that these things are being placed everywhere in a lot of different scenarios that allow for the day-to-day to be human-centric, and the devices on the periphery or on the body that are essentially transparent to the experience.
Yeah.
That's one.
Yeah, that's amazing. I mean, I've seen a lot of wearables over like the last 10 years.
Mm-hmm.
Even, the Google glasses, whatever it is. And it's like now for the first time, it's exciting because to your point, I do think that a lot of that is going to be pushed over the
Right.
next, like more so, even though it's been around, just like telehealth's been around and then COVID came and everyone's like, how do I see my dog? And people just didn't know,
That's right.
so it's like everything's finally bubbling and coming up to the surface to like learn.
That's right. Those technologies, these things are growing so rapidly. I mean, today we already have a lot of these things. Like you said, wearables have been around for well over a decade, right? And as they evolve, as they get more AI capability built into them, as they're able to move data more quickly and process it in real time, on the fly, on the edge, where you are, actively providing that guidance, it's amazing. It's that element of you're sensing data, and can you also react to that data in real time wherever that patient is. Having that idea of your hospital setting is on your phone with you at all times, it's on your body with you at all times. The physician can track your vitals wherever you are, and if something happens, they're able to respond more quickly or immediately even. But I think the second thing that I would also tell you that I'm really excited about, but I don't know if it's 3 to 5 years, maybe it's more years, but the idea of doing effective disease prediction. And we talk about it from the standpoint of, if I have a lookalike patient, then there's a likelihood that this patient will encounter something similar, right? And so these patterns are being done today. Can you combine that with genomic data? Can you combine that with higher fidelity data, more information to really help understand and identify what is actually causing diseases of various sorts, what is actually causing some of the need for certain procedures, what is causing these conditions? Can we preempt that? Can we get predictive models that are actively available that we're able to outreach patients about, work with them to prevent having to have those procedures, to prevent having to have surgeries for various things? Can we get ahead of the curve on that? And I've seen a few different vendors that are starting to push the envelope on this. I think that it's still fairly early stages in many situations, but I think that that's something that specifically AI, the way we're using machine learning to really identify the intricacy of data that is available and the sheer volume of data that we are generating. Healthcare generates tremendous amounts of data, but beyond healthcare, your day-to-day lifestyle generates data. Your
Right.
driving habits generate data. Your walking habits generate data. Everything generates data. Can that data be used to help produce a prediction for what might happen to you with a certain amount of confidence in the near future? And can we preempt that?
I love that. I know we're running out of time and I want to keep talking, but I have one more question for you. I feel, for a lot of the industry leaders that I talk to, and the organizations that we're working with, the technology burden is what is the physician burden. We're
Mhm.
talking about the clinical burden, the physician burnout, and it's because it's just more ask, more and more and more and demanding, and it's layering it on. So what is your advice to a healthcare organization that wants to be future ready, that wants to, but they also feel overwhelmed by it? What is your advice to them? They're like, yeah, this is great. And I know what it can do,
Mhm.
but as a leader, I feel like I don't want to burden my team with more technology. So, how do they become a future ready healthcare organization without the overwhelm or adding what feels like a burden to their team?
Fundamentally, when we're building or deploying solutions, whether it's AI or non AI, it doesn't matter. But any of these technology solutions, fundamentally, trust is a key factor in this. Do they trust that this tool is going to actually be effective and helpful to me? Will this tool actually make my life better, or the patient experience better, or the quality or the safety better, right? Fundamentally, trust is key. Don't expect the trust to be there on day one. You have to build that trust. And you have to build that trust through a partnership mentality. And so when you're coming from the technology side, if you simply build a piece of technology and deploy it, they're not going to use it because they haven't been involved in the process. Bring your operators into the process before you even start, while you're still ideating, while you're still trying to figure out what should be done, what the problem is. So that I think that's step one. But when you're deploying these tools, the real question becomes that transparent interaction mentality. Does the provider have to go through additional clicks, additional hops, additional steps to actually get something done? Or do they have a more transparent experience? The information is already there. It bugs me whenever I see an AI model that is predicting a next action for something and is declarative and definitive to say, is this, here's what it is, because it could be wrong. And it could be very wrong, or it could be just a little bit wrong. And so I really like it when we build these tools that give you a recommendation that says there's a probability of 70% that it's this, 20% that it's this, 10% that it's this, as giving options. And so it's building these tools that give not prescriptive, it has to be this, you have to do this, you have no choice, but instead giving options and recommendations for individual things. And so if you're able to create that level of experience, I think that you're going to get a much, much higher adoption rate for these tools and not overworking rate. Because instead of them having to go and look at this and then go and figure out, is it this? Instead, they're seeing options and they're going, yeah, I believe this. I don't believe this. I don't believe this. Or when you let me put it this way. Let me bring this back to a human element. If I come to you and I say, April, I know that it is this problem that you're facing, and this is absolutely the only solution you have to solve this. Or if I say, hey, April, there's a few options that you have to solve this problem. You can do this, this, or this. I think it should be this one over here, but these are, some of the options that you have. Which one are you more likely to go with?
Right. The one where we're working together to talk it through.
Exactly. It's not me telling you you have to do this. It's here are options. Let's figure out how to make this work together.
I love that. I love that. I mean, I've learned a lot from you today. And I agree, that's it. There isn't a one size fits all. And I think the approach is everything. I mean, that's what I've really learned from you today is, what is your goal and how do you approach it?
Hmm.
And then together you look at options and then implement accordingly. But together, at the end of the day, if you do it together, then it's not going to feel overwhelming. It's going to feel probably exciting more than anything. They're like, wait, it can do this. And I got to say, I think for me, I've been implementing and teaching and supporting EHR since 2004. And I think what happened there, you remember that back in the day, is they didn't get a say. They were
Right.
just told. No one sat with the neurosurgeon and said, how would you like me to customize this for you? How can I reduce your clicks? Instead it's like, here's an HR, you have to use it. It's like, wait. And so I know that's why I started my firm, was for that very reason. Cause I'm like, nobody's asking the end user,
Right.
So I love your approach. If people want to reach out or find you, is it best to reach you on LinkedIn? I could leave your LinkedIn profile. Is that ideal, or
Yeah,
is there a better way?
absolutely. I'm one of very few Yaitsky's on LinkedIn, so by all means, reach out to me, shoot me a message. You can also go to lulav.ai and reach the organization through those means as well. So if you're
Spell
looking
that
for
for the audience.
LULAV.
Thank Not everybody speaks engineering language. Amazing. Well, we'll make sure to include that in the description. It has been an honor learning from you. I'm excited for you. I know a lot of my clients are probably going to even be interested in reaching out, and I love how you're helping startups and really investing in them as well as the future of technology. It's been an honor having you, Nick. Thank you so much for your time and for your wisdom.
Thank you, April. This has been a great experience. Really love it.
Good. We'll talk again soon.
Every leader has a story, and every story reveals another piece of the bigger picture. What if the missing piece wasn't something you had to find, but something you were meant to become? Subscribe, share, and keep leading with intention. I'm April Reed, and I'll see you in the next conversation on The Missing Piece.